Hello, I am Dr. Mahendranath. I am one of the senior most rheumatologists of the country, and I practice rheumatology for last 44 years in Bangalore. I am the first rheumatologist of Karnataka. Today I am going to talk to you about one of the most common diseases, autoimmune diseases we see in rheumatology. There are several diseases, autoimmune diseases, common like rheumatoid arthritis, gout, systemic sclerosis, systemic lupus erythematosus, which is commonly known as lupus, and many others. I am going to talk about lupus or systemic lupus erythematosus, which affects mainly childbearing age women. Lupus is always a very, very difficult disease to treat. 20 to 30 years back, there were not many medicines available. There were not many diagnostic tools available to diagnose lupus. And lupus people used to suffer or lose their life very early. But things have changed tremendously over the last 2 decades. So lupus patients can lead a near normal life with the doctor's help and the appropriate medication. Usually lupus people are sun sensitive. Sun is their enemy basically. So when they go out, they must use a good sun sensitive, sun protective cream, probably SF50 and beyond that they must use. They must use full sleeved cloths as much as possible and minimum exposed sunlight, or use a hat or use an umbrella in our country. Avoid sun because direct sunlight can trigger off an attack of lupus immediately and they will suffer. So sun is your enemy. So unfortunately, ours is a hot country. Sun rays are very hot and they trigger off lupus. So you should be well aware of this to avoid sunlight as much as possible. Preferably if you want to do it either in the early morning or in the late evening when there is sun rays are not much affecting you. The second thing is regarding medication. Medications people do ask, do I take medications lifelong? Yes, unfortunately you have to take. People forget that for diabetes you take medicines lifelong, for hypertension you take medicine lifelong, for heart disease you take medicine lifelong. So why not for lupus? Lupus is also another disease like that. So you need to take medicine. And there are several types of medicine. Basic medicines are probably anchor drug is hydroxychloroquine, which we use to control the lupus actually. You have to remain hydroxychloroquine lifelong to control the disease and disease flare-up and to prevent complication. Hydroxychloroquine is a very safe drug. Very rarely it can cause some eye problems, but we monitor them regularly. The other problem in this country is people develop dark pigmentation after a long time in hydroxychloroquine. That probably you can be avoided by using an appropriate cream and all these things, but having little pigmentation or darkness is better than not having a good life or suffering. So I would rather prefer you to continue hydroxychloroquine lifelong. Apart from hydroxychloroquine, you use other drugs like azathioprine, methotrexate, tacrolimus. There are plenty of newer drugs now to control the disease. So you do not worry about the drug side effects and all, because all the side effects of the drugs on one side, disease on the other side, your disease kills you if you don't take it, the medicine. So you do not worry about it. So people with lupus also ask, can I become pregnant? Can I conceive? There is absolutely no contraindication for a lupus lady to become pregnant. The only thing is the disease should be under control. Because the disease should be under control or remission at least for 6 months before you conceive. Because if the disease is not active, it is very, very difficult to conceive because your fertility will be low. If the disease and inflammation is well controlled, you can conceive happily. But 6 months the disease should be in remission. And during pregnancy, sometimes people can experience difficulty during pregnancy and labor, but doctors can manage them. You don't have to stop hydroxychloroquine during pregnancy. There are only few drugs, toxic drugs, we advise them to stop so that it doesn't harm the baby. Drugs like methotrexate, drugs like leflunomide and all. But there are other drugs like hydroxychloroquine and azathioprine which can be safely continued during pregnancy, during lactation. Also, we can do that. So, probably these medicines are safe. All you need is to stick on to your doctor's advice and continue medication. It's the most important thing. One is lifestyle changes, not putting on weight, doing exercises regularly, keeping fit and active, eating plenty of fruits and vegetables, and avoiding red meat or non-vegetarian food as much as possible. I am not against any food as such, but we have found out our experience, red meat can do damage, and personally I advise, many people may not agree with me, I advise them to avoid non-vegetarian food for a couple of months during pregnancy, early pregnancy or childhood and all. And they can have, some of them can have a normal delivery, some may have to have cesareans and interventions and all, but probably they can have normal delivery, child can be healthy, your lupus unlikely to affect the child. That's very, very important. If probably only thing is lupus pregnancy should be handled by obstetricians who are trained in high risk pregnancy management. Normal obstetrician may find it difficult to handle lupus pregnancies. So it is a multidisciplinary team effect. A good rheumatologist and a good gynecologist or a obstetrician and a good pediatrician. This is a combination therapy. So you can lead absolutely near normal life with lupus. You don't have to worry about lupus. All right. Lupus doesn't kill you as long as you take your medicines properly, listen to your doctor, and adjust to lifestyle changes. Any unusual physical strain, any unusual mental strain, or any simple infections sometimes can cause a flare-up of the disease temporarily, but they can be managed very efficiently by a good rheumatologist. You must listen to your rheumatologist, follow your rheumatologist. Only your rheumatologist can help you. No one can help you. So there are plenty of rheumatologists across Karnataka, across the country, and they can reach you there. There are plenty of material, patient awareness material regarding lupus, both print as well as audio-visual media is available. Please go through them. Never hesitate to ask your rheumatologist. If you have any doubt, clear them. Don't keep in yourself. Knowledge is better. Understanding your disease is better. Your understanding your disease is half the treatment is done. The remaining treatment, we will manage that. Thank you very much.